We went down the path of looking at technology and specifically looking at AI. The problem that we were solving is not enough clinicians to take care of the population, but also managing, hiring, training, onboarding those clinicians. That's a pain in the butt. So, where can AI help me here? So we built a physician AI agent. What we did is we took an MD expert, we built a model out of it, an AI model out of it. So thing one that we can do with it is consumer grade, educational. And so you can, and you can do that either as like a lead gen. You put it inside of your funnel as a lead magnet that you can interact with our AI bot to learn more about fertility or learn more about XYZ, right? So that can be early in your patient acquisition cycle of giving a free thing out there or giving like a low cost thing out there so that people learn and understand that what they have going on has treatment, has management. They're a more educated consumer and they build a brand affinity to you. Layer two that you can do with that AI model is deliver care. It literally does what I would do. Actually, it doesn't do what I would do. It does what I would do if I was a resident, meaning I take information, I gather, patient's history, I synthesize it, and I go to the expert in the room and say, here's the story, here's what I found, here's what I recommend, take over from here. And this is exactly what a resident would do in a hospital, where now I, as the expert attending, I now walk in afterwards and say, great, here's what I know about you. Here's what we will do. I've got your story. I've got your plan. Here's the thing. And so either you've agreed with your resident or you disagreed with your resident, but you, the doctor in the loop, you are now responsible and able to take care of that situation. More usable, I think, might be, okay, you have this AI agent, but it's more of a co-pilot rather than the front end. So the co-pilot version of the same model, it's essentially, especially for your young or training or now still onboarding APPs, they have because it's hard to always get on those Zoom calls or get immediate answers on Slack, you've got a bot that basically can answer those questions for you faster, more immediately, and it's literally sitting on their desktop or on a browser, and they can ask questions even while they're having a telehealth visit with a patient, right? Or right afterwards to kind of figure out, what do I do? How do I kind of solve this? And so, and it can work in two ways. Either it's clinical information that it's providing you, but it's also very, any of your SOPs or any of like supporting things of how your business work. How do I send a prescription for testosterone, which has X, Y, and Z issues around it. And so like, so basically like your most common questions that maybe you already answer, maybe they're hidden inside of some protocol or some system or some document, but now this agent is able to support your new hires to work alongside them faster than Slack can respond, faster than a Zoom room could respond, faster than their supporting NP, supervising NP can respond. So using it in both clinical, but also non-clinical admin related questions that the new hires often have. So there's like intakes, but what you're really looking for is like advanced intake and triaging. So we do that in our app currently. So what we do is essentially we take and before a patient comes in for a visit, we can take they get an intake. And but it doesn't have to be an intake. It could be like it's almost like a nurse is calling you and just getting initial information to make sure you're prepared for your appointment or make sure you know what to expect when you show up and what's commonly happened. And these are the things that like AI is like excellent for, because here's kind of what the scenario looks like. What you would do is, and it doesn't require a ton of training. It just requires like what your protocol might be. But what you would do is you have to pick your channel. Is it voice or is it a chatbot or is it a form? Any of those can work. So if you already have like a system that you use for like form intakes, you could basically jump on that existing channel. Let's say it is intake, something very basic. It's a form. They fill out the form or they've uploaded or typed in whatever their current testosterone level is. You ask, the next question in your form is like, do you have a second number or not? And so anyway, you've captured all this data that can be very, simply synthesized, like here's the profile of the patient as it exists before their appointment. And then the second thing that you would do is a second agent would construct a best next step here. That could be based on the synthesis of this information. They should wait 2 weeks and actually get their lab first, or, yep, they're good for the appointment, or this is the information they just need to know in preparation for their appointment. The hardest part here is, do you have those flows worked out? And there's a ongoing cycle of improvement of you would have to kind of get into to ensure that, you'll get like a bulk, say 80-20 rule. You'll get 80% solved on your first go, but it's the edge cases that emerge later in that 20% mark that you have to kind of continue to, refine and improve. So it's plug and play, but the plug and play probably would work for 80% of your use cases, but anticipate that maintenance, would take probably several months until you reach a good level of like greater than 90%. It works exactly the way you would want it to, or like would work like a smart nurse who just spoke with the patient before their visit. That's the level you want to get to. But it first depends on like, do you have, and it's not like you need training data. You can get away with like a protocol, something written, a document, something that has this system protocol document, and you can use the AI can kind of basically use that document to know what to do. So those are kind of the 5 layers by which we think about AI. But like I said, the most experimental that we're experimenting with is literally using it to deliver care, or to be the front end or the first layer of care, but always having a clinician in the loop behind the scenes. We're not at a stage, certainly not legally at the stage, where an AI agent can deliver care. That would be illegal still. Not licensed to perform medicine.